My name's Janice McCallum. I'm here at Connected Health primarily as a member and board member of the Society for Participatory Medicine. I can tell you a little bit about my background, how I got involved in this whole area. I actually started off as a researcher doing a lot of data analysis, went on and got an MBA in marketing, analytics. All my friends at the time were studying finance and going off into investment banking, but I was more interested in data and the power of information. Worked for one of the original information services companies, online information services companies, in the era when online meant dialing up to a connection through a modem. Some of you may remember that. So things were slow, things were a little painful, but we've progressed a lot. Common thread is getting the right information to the right people at the right time to improve decision making. Some of you may know about Regina Holiday and the walking gallery movement. I believe there's over 500 jackets now. I'm jacket number 90. My health story is fairly complex. A part of my story is portrayed on my back through my walking gallery jacket. I'm the little girl, just to remind you, in the Wonder Woman underoos, which thank you, Regina, for doing that. But my story started when I was just an infant. In fact, my father was ill. He had a brain tumor, and that affected my life. I now say I became a patient advocate at, from the time I can remember to about age 5 when I saw my father and the after effects of his surgery. My mother and I remained patient advocates for him, and then I later in life, after my father died, helped my mother through her remaining years, and she was quite healthy. She had cancer, but I helped her write her wishes, make sure her wishes were respected. And just a year ago, when she died, she had the kind of death she wanted. She was still in control. She was still lucid. The society, again, it goes back to information and data. The power of information. Information is power, but people often say knowledge is power, but I'll take it back. I'll say information is power, because too many judgments are made about what people may understand. And even yesterday and the day before at this conference, I've heard people say, well, you don't want to give this kind of information to patients. They won't interpret it right at that time. It's like, no, let the patients decide. I don't think there's ever a reason to say you should withhold information. First of all, if there's unequal information, that cannot lead to shared decision making. You have to allow patients to have access to the information. They may not understand it all, but they can ask questions. And I'd like to see more information created for patients to guide them to resources. We had the National Library of Medicine director at our SPM conference on Wednesday, and she mentioned that they have these terrific resources. They will create the databases, but there really needs to be a third party to customize them and improve the interface for different audiences. I'm eager to see more of that done for patients. It's done for other segments who pay more, let's say. But I heard of the society through ePatient Dave back in 2009, when the famous story of how he tried to download his electronic health record from Beth Israel via Google Health. The Boston Globe wrote it up, and Dave and I had lunch shortly after that. Just all of the objectives of the society mesh with what I believe is important, and it's been a terrific experience. I joined the board this year. I've known most of the board members, and it's a very passionate, committed group of volunteers really trying to change, or as the sign says, transform the culture of care. We often hear there's a technology issue. Well, I've been involved in digital transformation for many, many years. I've been taking an active part of that. It's not a technology issue, really. There may be some complex issues, but it's really a cultural issue and an economic issue. If the incentives aren't there, In fact, if the counter incentives are there, it's going to be much more difficult to effect change. But there's a lot of people, there's been a lot of interest in the society at this conference. There's a lot of momentum growing, and we think it's time for the next level of change and the next spurt of growth in the society. And we look forward to seeing how we can, as a group, inform and connect the community. Well, what's unique about the society is, there are lots of medical societies where it's groups of specialist doctors, or there are patient communities. The Society for Participatory Medicine is unique because it really includes both of them. Physicians, clinicians, nurses, well, of course nurses are clinicians, patients, patient advocates, family caregivers, researchers, and industry. There's lots of people in health IT and in pharma and other organizations that do want to engage patients more, inform patients more, and they're all members of the society. It's a very inclusive group. We think that it's not us against them. It's not patients saying, doctors, you're wrong. It's patients saying, doctors, let's work together, and vice versa. Not all doctors think patients should be left in the dark. I remain hopeful. I look at things with a sort of an economics perspective, and I think fundamentally incentives need to change. One of the biggest issues right now in healthcare is cost. When I look at innovation, I now ask, is this innovation going to lead to lower cost or greater ability for people to access healthcare? And if the answer is not clear, then I'm not that interested in that innovation. I think it's so critical that we solve that problem now. I am at healthcontentadvisors.com. That's my website. I'm pretty well known on Twitter. I've been on Twitter for almost 10 years and have a fantastic community on Twitter, and that's at Janice McCallum. I thought I had my badge on, I don't, but at JANICEMCCALLUM.